So raise your hands if you've ever had antibiotics. Let's see, one, two, pretty much everyone. Yeah, I figured. I get it, bacteria are the bad guys, and we spend a lot of time trying to get rid of bacteria. The antibiotics, disinfecting wipes, hand sanitizer, we even put them in those little keychains and take them around with us everywhere. So I understand, bacteria are the bad guys. But let me ask you an uncomfortable question then. What if I told you we were using bacteria to try to treat cancer? It's a little weird, I know. I promise you I had the same reaction. See, I'm actually early in my career as a physician, but I'm still learning what it means to treat cancer. Yes, from professors and textbooks, but also from patients. And I once had a patient who asked me a question that I wasn't ready for. She looked at me, calm and direct, and asked, "Is the treatment going to hurt me?" And I wish I could tell you that I had a confident answer, but the truth is, I hesitated, because I realized in that moment that the answer is sometimes yes. Not because we don't care, and certainly not because we don't try, but because for a long time, the way that we've been treating cancer has been incredibly powerful, but painfully imprecise. Imagine that you have a root in your garden, a weed, excuse me, and instead of just pulling it, you pour gasoline over everything and light a match. That's chemotherapy, and it's actually one of our best tools. There are times that I take care of women with gynecologic cancers, and a common one that we treat is called ovarian cancer. And oftentimes, when we find it, it has already spread. So we rely heavily on chemotherapy. And a common drug that we use is called paclitaxel. It's effective and it saves lives. But patients don't treat it as just another medication. They experience hair loss, pain in their hands and feet, nausea, fatigue, extreme weight loss. I've had patients say that they feel like they're trading one disease for another. And for a long time, that was a trade-off that we had to accept. We're going to treat the cancer, but hurt the patient too. So over 100 years ago, there was a scientist named Paul Ehrlich, and he imagined something different. He called it the magic bullet, a treatment that would only find the disease cells and leave everything else alone. And for a long time, that idea seemed out of reach. But today we're getting much closer, and the answer lies with something incredibly small. So a human hair is about 100 micrometers wide. Cancer cells are 10 times smaller. Particles that we can start to build and engineer, they can be up to 1,000 times smaller than hair. They're called nanoparticles, and we can use them as tiny drug delivery systems that travel throughout the bloodstream. So now remember that ovarian cancer. So when it starts to grow, it can grow rapidly, and when it builds its own blood vessels, it has to rush the job. So blood vessels of the tumors are leaky, they're messy, they're full of gaps. These nanoparticles can take advantage of that fact. They can slip through the gaps of these tumor blood vessels, but stay out of most healthy tissue. So now imagine, instead of giving paclitaxel in a way that spreads throughout the entire body, we package it inside these nanoparticles so that more of the drug goes inside the tumor and less inside of healthy tissue. It's the same drug, but with much better aim. And for patients, this means less severe reactions, less toxicity. Now, what if we didn't stop there? What if I asked you that same strange question I asked earlier? What if we use something living like bacteria? Because it turns out inside of a tumor might be an ideal environment for bacteria. There's low oxygen, there's weak immune defenses, it's a chaotic environment. And for some bacteria, they could thrive. So scientists start to engineer these bacteria to remove the things that make them dangerous and add things that make them useful. And this isn't just theory. I can give you another example. Cervical cancer. We know that it's caused by HPV, the human papillomavirus. You may have heard of this vaccine as something, you may have heard of the HPV vaccine, but that can prevent infection and by extension, prevent cervical cancer. But what about the women who already have HPV-driven cancer? So scientists took a bacterium called Listeria. You may have heard of this bacteria whenever it makes the news because it causes food recalls. It can contaminate meats and cheeses and give you food poisoning. But Listeria actually has a superpower. So whenever your immune cells swallow it, which is what your immune system's supposed to do, it's supposed to eat up the invaders, most bacteria get trapped and destroyed, but not Listeria. It's able to evade being destroyed and just live inside of an immune cell. So scientists looked at that and thought, how can we take advantage of that ability? So here's what they did. They first deleted the genes of the listeria that make it dangerous, and instead inserted genes from HPV itself, specifically the E7 protein. This protein is what makes cervical cancer cells cancerous. So now when this engineered bacterium gets swallowed by your immune cells, it's going to evade getting destroyed just like it evolved to do, and instead will just replicate this HPV cancer protein within the cell. Your immune cell will then take that protein and display it on its surface so that it functions like a wanted poster. Now your immune system will see that and think any cell that has this protein is the enemy, and then it goes hunting. So there was a clinical trial of 109 women with recurrent cervical cancer. These are women who already failed other treatments. And this bacterial therapy achieved a 12-month survival of 35%. Now, that number might not be as big as you might like, but for women who were told they have no other options, that number means something. We took a foodborne pathogen, something that we spent decades trying to keep out of our kitchen, and we turned it into a cancer-fighting tool. And that's the power of bacterial therapy. And what's even more remarkable is that we can engineer these bacteria. We can start to program them to tell them, go inside the tumor and only deliver your drugs then, call the immune system when you get there, and self-destruct at the right moment. This is no longer just giving medicine. This is programmable therapy inside the body. And this is crucial because it helps us address another issue. It turns out your immune system is already very good at killing cancer cells, but only if it can see it. A lot of advanced cancers and tumors, especially the ones where they start to spread, they can hide from the immune system. We call them cold tumors. They're invisible to your immune system. We have something called immunotherapy that has changed cancer care by activating your immune system, but it only works once it sees the cancer cells. And this is where engineered bacterium can help. When the bacteria enter the tumor, they can create inflammation, and they will send out signals and act like a flare. So it turns cold tumors into hot ones. Now your immune system can see it and attack. So now take a patient with something like ovarian cancer, and let's imagine this future. Instead of flooding her body with chemotherapy, we use nanoparticles to deliver drugs precisely where they're needed. We use bacteria to enter tumors and activate treatment from within, and then we use the immune system to finish the job. Not one blunt tool, but a coordinated, intelligent system. For most of history, we've treated cancer in 3 ways. We either cut it out with surgery, we burn it with radiation, or we poison it with chemotherapy. But now, we're doing something fundamentally different. We're engineering solutions and programming therapies to tell it where to go, when to activate, and how your body can respond. So I think back to that patient who asked me, is this treatment going to hurt? And for a long time, the answer was yes. But what's changed now is we're no longer satisfied with that answer. We're moving from brute force to intelligence. So now that I think about the next patient who asked me, is this treatment going to hurt me? I'm optimistic that one day, very soon, the answer will be not like it used to. Thank you so much for your time.